Cancer in the GI tract is one of the worst things I can ever tell anyone that they have. It's such a difficult conversation to have. I hate it, hate it, hate it. And a lot of the cancers that we see are preventable if we can find them early. Well, in this video today, I'm going to go over the common symptoms that you can get from a GI cancer. I'm going to talk about lifestyle and diet changes I recommend to prevent cancer. And at the very end of the video, I'll give you my tips on what you can do today to make sure you don't get cancer. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru. I'm trying to give you, yes you, the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks like you're learning in this video. I absolutely hate cancer. It is the worst conversation I can ever have with a patient and their family. It is the worst thing that I can find, and I have made it my mission to stamp out cancer. Here are some of the more common symptoms you need to worry about if you're wondering if you have some sort of GI or gastrointestinal cancer. Number one is a change or a difference in your appetite. Now, your appetite can really be a cause or a symptom of a lot of different things, but one of the more common things that I worry about is whether there's a cancer inside your GI tract, whether it's a cancer in your esophagus, cancer in your stomach, or cancer in your colon. Those cancer cells can make you not feel as if you want to eat, can make you feel fuller quicker and more often, and can really change that. And with that, you can have a tremendous amount of weight loss as well. So if you notice, hey, I am not eating as much as I used to, or the portion size that I had before is just not as much as I would want, this is something we need to get investigated. A second possible sign of cancer is a new change in your bowel habits. Now, I know that for a lot of people, we can fluctuate between diarrhea and constipation. It can be kind of a normal thing, but one of the things that worries me is, especially if you're over the age of 45, you have a new change in your bowel habits. So for example, let's say you are constipated forever, it's been your way, and all of a sudden, hey, I'm having a lot more diarrhea than usual. That is something that is not a good thing to have. Or if you start to notice a change in the caliber of your stools to become more pencil thin, or a change in the structure, and this does not seem to get better, this is something that needs to be investigated, and we need to see exactly what is going on. Number three, I mentioned this before, but weight loss, especially if that weight loss is not intentional. Now, I know people want to lose weight. I know people are gonna try and feel, hey, I'm getting cut. This is great, I'm losing that weight, but this is not the way I want you to lose weight. If you're losing weight, but it's not intentional, you're not trying to do this, this is something that needs to get investigated. We need to see exactly what is going on. Number four, your doctor says they're noticing a change in your lab. Let's say that your blood count starts to become lower or become anemic, or your platelets become low, your liver numbers go out of whack. These are some subtle signs that your body is telling you and your doctor that something weird is going on that you should not ignore, and we need to get investigated. And then lastly, number five, unfortunately, it could be no signs. And this is the difficult thing about health and cancer, is that sometimes it can present as nothing at all with no preceding signs or symptoms until you actually have what's going on. Which is why, and I'm going to stress at the end, we want to do screening when you're feeling good to find these things before they become cancer. Now that I freaked you out about some of the signs of cancer, here are some recommended lifestyle and dietary things that is based on evidence that has been shown to minimize, or at least minimize, that risk for you developing cancer. Number one, don't smoke. I mean, come on. It is 2021. For 50 plus years, we have known that smoking is not good for you. So don't do it. There is literally nothing good that's going to come from smoking. It has so many carcinogens that you inhale, and this can cause so many different cancers, both inside the gut and outside the gut. Now, don't be fooled that things like shisha, hookah, vaping, it's not a big deal. Well, guess what? It is, and you can still get cancer from them. Number two, try to stop or minimize alcohol. Now, I know people enjoy alcohol, okay? I know this, but we do know that alcohol is a risk factor for a lot of cancers. Liver cancer, esophageal cancer, other cancers that are out there. And this is a bad combination whenever you combine that with smoking. It's almost like a triple or quadruple whammy when you have both at the same time. If you can stop alcohol, do that. If you're drinking a lot, try to minimize that. Number 3, stop animal fats and animal proteins. There are so many studies, so much more evidence how diet can really play a role when it comes for your risk of cancer. And animal fat and animal protein are some of the biggest risk factors that you can have. There are studies after studies suggesting this, and there are studies to show if you can change your diet to more of a plant-based diet, you're going to really dramatically decrease your risk of developing cancer. Number 4, add leafy green vegetables to your food. So this goes heart and heart with a plant-based diet or a Mediterranean type diet. Those leafy vegetables have fiber. Fiber are cancer-killing foods. It makes the background for your gut microbiome. It makes your good guys happy. It destroys your bad guys. And by doing all that, you can minimize your risk for developing cancer. And then number 5, eliminate processed foods. Guys, it's not good for you. I mean, just imagine that term, processed foods. These are foods that are not made for you. Basically, it's something that's in a wrapping paper and it's fast food. It's not good for you. They're full of saturated fats. They're full of bad carbohydrates, bad fat, chemicals. It's just eating poison. Don't do that. Don't hurt yourself. We want you to live as long as you can. Hey, I hope you're getting great value from this video. If you haven't already, don't forget to smash that like button and comment down below. So what can you do today, yes today, to minimize your risk for cancer or maybe to save somebody who you love? Here are 3 tips. Number 1, know your family history. Genetics plays a significant role when it comes to developing colon cancer, stomach cancer, esophageal cancers, or other cancers inside your GI tract. Know your family history. Who has had cancer? What type of cancer? Where was it at? What age did they have the diagnosis? These are important things for me as a doctor to know and understand so I can see exactly when I need to do screening for you. Number 2, get your screening test. I need to stress this. We want to get yourself screened when you're feeling well. This is why we do these procedures, while we do upper endoscopies and colonoscopies, maybe imaging as well, because we want to find things before they become cancer. They are screening for a reason. You want to do it before there's any issues. This is probably the best way for us to find precancerous lesions and remove them. The issue with precancerous lesions is that they typically don't cause symptoms. You may be feeling great, chilling out, not doing everything, but then come to realize that if you get your screening test, you had something growing inside your body that had a 100% chance of going to cancer. And by getting your screening test done and removing that risk, boom, you're going to live a longer life. And then lastly, number 3, don't let fear or embarrassment destroy you or make you have regrets later on. I've had so many patients who wished they would have got their colonoscopy sooner, but they didn't because they were embarrassed, they were scared, they didn't want to get it done. And because of that, and because they waited, they ended up having colon cancer. One simple test that you start at the age of 45, that you get done, get it out of the way, check that list off so you can get your screening done, saved so many people's lives. And the people that develop cancer are those that unfortunately way too long had cancer, and unfortunately it was already too late for them. My question today for you: what would you add to this list? What would you subtract? What questions do you have to help prevent cancers in the GI tract? Comment down below. I would love to hear what you guys have to say. But thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where you can get great tips and tricks from yours truly every week coming straight to your inbox. Guys, I hope you have a happy and healthy day. And don't forget, let's talk about poop. Thanks, guys. And if you are interested in what you can do today to help prevent colon cancer, click this video right here.